Hi there, welcome back. This is the Perio Patient Podcast, and I am Dr. Ben Young. Episode number 40. I've entitled this one, Digging Deeper into COVID-19. And this one comes from, is a continuation sort of from the last podcast, because although I thought I had finished with it, it kept bugging me as I was thinking about it later. And about how I'm saying that it's a better situation now with regards to this COVID-19 than it was when we began. I think I explained that pretty well in the last episode. But I'm still sensing, just in what I'm watching on TV, reading articles, that there is a great fear and worry about this virus that I think is more than it deserves. And so I'd like to, just for a few moments together, let's kind of think about this virus behavior and then look at some numbers that I hope will kind of put this into better context for us to be able to make decisions. So let's start with thinking about how someone becomes infected. To become infected, you have to be in proximity with somebody who has the virus, and they have to have enough virus for you to become sick with it. That means that the number of viruses that are invading your cells, if they're too low, then your body will probably process them to create an immune response and give you immunity before you ever have any symptoms. So you might test positive for the virus but never have experienced any illness. If it does not give you the immunity fast enough, or there's too many viruses, then you will probably become sick. And just like we know from being around people who are coughing and sneezing and then ourselves coming down with the flu, that people shed viruses a whole lot at certain times when they're showing symptoms or just before. But then after they're well, they're not shedding any viruses at all, very little. And that would be true with COVID-19 as well. It's our proximity to people who are having symptoms is our greatest predictor. However, the problem being that the viruses are invisible and they may be shedding before they show symptoms. We don't have 100% ability to just operate in normal. And that's why we do the social distancing and the masking and all the rest of it, because we may be passing people who are shedding viruses and we have no idea. And that also may be us. So the levels of viruses being spread is important, but then there's another thing that's important when it comes to illness. And that has to do with the risks within the one who receives the virus. How sick someone gets with this virus, I can think of two things that are important to consider. One is, how did the virus get into that person? If it lodged in the nasal passage, maybe it's going to be less of an illness than if they breathed it all the way into their lungs. The other thing is, did they swallow it on food or not? These also could have different presenting symptoms from the same virus. There's a second reason that people can become sick, and that is if they already have other weaknesses or illnesses. And this is the concept of comorbidity we hear people talking about. Comorbidity is having more than one medical problem, and then those problems affect the way an illness progresses. For example, let's think about diabetes. If someone has diabetes, it means that their body struggles with regulating sugar, and they lack enough insulin, which their body should be producing, to allow the sugar to get into the cells from the bloodstream. If they're locked out of the cells, then the sugar rises in the blood, and that's what we're looking at when we run blood sugar tests and things. The net result of having diabetes is that the cells don't work well. They're not getting the nourishment they need because the sugar isn't getting into the body, into the cells. It's staying in the blood. And it's also messing with the white blood cells that are whose job it is to find viruses and then mount an immune response. So diabetes is a comorbidity to COVID-19, and that's a serious problem. And here's the other comorbidity I want to talk about, and it's an important one with regards to this particular pandemic. We didn't know this was going to be the result until we began to see who was getting the sickest and who was dying, and those were people past the age of, say, 85. As a group, they are not functioning well at the cellular level, compared with people, again, in general, who are younger. This is why this group has a higher risk of dying not only from COVID compared to others, but also from flu and also from falls and having hip fractures. So now, with all this in mind, let's look at two numbers from different times throughout this COVID pandemic to see its behavior in the population in the United States. And the two numbers that we're going to talk about are the infection rate or the number of new cases, either one. That's the same thing. And then let's talk about the death rate. And let's do these on a per day kind of comparison. So the first one, the infection rate. How many people are becoming infected in a particular day, or at least reported on that day? And let's look at individual days separated, say, by about a month apart. And the way I've done this is to go to Google and just type in COVID statistics, COVID death rate, infectious rate, and you pop up graphs that come right up, and you can roll your mouse around to see what the numbers of infections were per day. There's a graph for that. On March 2, which is at the far left of the graph that I have, I don't think there were any reported before this. If it was so minimal, because this is going to be minimal, that it doesn't really matter. So on March 2 in the United States, there were 16 reported new cases. Now move out to April 2, and that number of new cases reported on that particular day was 29,717. That's 1,857 times more people having been infected on April 2 than were infected 1 month before. Now, what do you think the infection number will be on May 2? Since we have 2 points. The first one was March 2, 16 people. The second one, April 2, 29,717 people. What would you plot the next one to be? If you take it out linearly or whatever. So here is the answer. On May 2, the answer was 29,474. That's actually 243 fewer cases reported on that day than on the same day a month earlier. I think that's unexpectedly good. I was surprised, frankly, to see that. That would not be what I would have expected. So now let's move to June 2. What do you think that one's going to be? Well, the number of new cases reported was 20,791. That's 8,638 fewer cases reported on that day than a month earlier. That's really good. What I find interesting with this is in terms of infection rates is that every day there were new cases through this period that ranged from 18,000 all the way up to 30,000 new cases, and these are accumulating over time. And yet a month later, we still haven't seen that many new cases being reported. All right. So what about July 2? Well, that was 50,006. So the one before it, 20,791. This one, 50,006. Is this surprising? I don't think so. It has to do with how many people were infected or who were infectious before this, and that number was growing daily, accumulating over time. So now let's jump to yesterday, because let's not over swamp ourselves with numbers. So yesterday, what was the daily infection rate yesterday? October 22, the number was 75,064. And this is close to the highest one-day new infection report, which was actually back on July 16, which was 75,687. Both of them were over 75,000 cases. That's so minimal compared to the total number reported that it's within the margin of error. You can't really say one was higher than the other at that level. So here's what I get from all of this. If the spread had been unchecked, I would have expected an exponential increase in the number of cases, but that isn't what we are seeing. Some of it is likely due to the mitigation efforts that were employed. Some of it also has to do with the fact that just because someone becomes positive with the virus, it does not mean that from then on they are infectious. There is a window when they can give it to others, and then they no longer are a risk. Also, there is no evidence of reversal, that people are getting the virus a second time or becoming infectious again. I know there are a few anecdotal stories that have come out where someone got the virus twice, but if you go deeper into those stories, they have to do with real big comorbidities, like end-stage cancer. So we have to throw them out when taking these numbers and studying them seriously. All right, now let's go to death rates. Back to the beginning, which on my graph, again, was March 2. There were 3 deaths reported. Now, a month later, April 2, 1,216 deaths. So if we take the new cases on that day, which was 29,717, then the death rate for that day was 4%. That's not a good number, but these numbers are still too small when thinking about a total population of 331 million people. Okay, May 2, 1,583 deaths to 29,474 new cases. The death rate on that day, and I know this is arbitrary, 5.3%. Well, that isn't good. June 2, deaths, 1,082. New cases, 20,791. Death rate, 5.2%. July 2, deaths, 723. New cases, 50,006. Now what we're seeing is the numbers of death on that day are lower than the month before, which were slightly lower than the month before that. So the deaths per day in a general trend are heading down a little. It makes the death rate on July 2 to be 1.4%. The month before, it was 5.2%. That's a cut of a rate of about 27%. That's amazing. That's great. Now let's jump to yesterday, October 22, the latest report I have. 828 deaths and new cases, 75,064. That makes the death rate to be 1.1%. It's down 0.3% since that day in July. The death rate is continuing to drop while more are becoming infected. The reason, again, I believe has to do with improvements in treatment as well as isolation methods. There's no reason to lock down the country now. The more new cases is irrelevant because it will grow in the same way the sun will shine tomorrow, statistically speaking. Will it rise tomorrow? I don't know. Stay tuned. Chances are good. We can expect also the infectious rate per day for COVID-19 to increase as well. So don't let headlines about breaking any records on the number of new cases reported on a particular day to mean anything to you. It's irrelevant. It will likely happen many, many times going forward. Right now in the U.S., we have about 8.5 million cases reported. And we have a death rate or death total of 223,000. That makes the death rate of 2.6%. But again, I think this will ultimately end up being less, not more. And I don't think it'll be the same. And to again put this in perspective, our total population is 331 million. The percent of the population thus far infected is 8.5 million. Divide by 331 million. Move the decimal point 2 to the right for percentage, and it comes up 2.6%. I bet you weren't hearing that number anywhere. 2.6% of the population thus far are COVID positive. And the deaths percentage for the entire population, 0.07%. Let's compare this with the 2019-2020 influenza season according to the CDC. The number of cases was 38 million, about 4.5 times the number of COVID-19 cases thus far. But the deaths from the flu were 10 times lower than COVID at 22,000 compared with 223,000. But again, the population is different. I think the thing to note here is it isn't the flu. It is more deadly. And the difference also is that they hit different populations. COVID-19 is primarily killing elderly. The flu is most affecting the vulnerable among us who are children, ages 0 to 4. So we here follow the science. I've said in earlier podcasts that that is a silly notion because it isn't how science works. The work of science involves data accumulation, analysis, speculation, which is simply guessing, and then testing our guesses, which we call hypotheses, to impress others. If the tests do not stand up to what we think will happen, then we try to think about other possibilities. The future is unknown. Science can't figure out the future. It can analyze data, and perhaps by seeing what has happened in the past, it can help us plot possible lines into the future. But just with the numbers I forced you to think about today, we can't predict much with any accuracy. That's the best science can give us, but in many ways it is enough because slowly over time and with a few breakthroughs here and there, we find ourselves in a better place than our ancestors were in. Sadly, however, the accumulation of technology does not really change the basic behavior of people, and every generation that is born starts at the very beginning of ignorance, which then requires those a bit older and hopefully wiser to teach and instruct and guide until the human child reaches a level of maturity where they can think clearly and beyond themselves in order to be able to contribute to the education of then the next generation, and on it goes. I think that's enough for now. I appreciate you listening. I am grateful that you would, because I think it's really what's so important about our type of healthcare is the more that patients can understand. It's not that you have to know everything about everything, but if you can know enough to grasp what is important, I think it'll help you make good decisions. When it comes to COVID, the questions we have to ask ourselves are, what are the risks of managing our days in public? Another way to put this would be, should I social distance and do I need to lock down more? What are my risks? Experts can provide information and advice, but they should not be given so much power that they control our daily decisions. Otherwise, we have moved into a different kind of society run from the top down. For me, I have to understand the equipment around me enough to be able to decide what to do when something breaks. I need my repairman to give me a good enough explanation so I can understand whether I need to have something repaired or replaced. It's the same with you. And for you, when it comes to dentistry, again, you need to constantly ask questions and seek clear answers. that then enable you to give what we call informed consent in order to then allow us to serve you well. I'm hoping that from this podcast, I'm equipping you to be really good at what you need to be when it comes to healthcare. And that's inquisitive and unafraid to ask important questions. And the important question is the thing you wonder and you don't know. It's not a matter of whether or not you think it's foolish or not. If you have a question, you need to ask it. And I am the same way. I've really gotten, as I gotten older, when I walk into things and I don't understand, I just ask. If it had been me, the same me back in high school or some other time, I would have been afraid to do that. But I guess the older you get, the less you care about what other people think. And you just step out there and say, and the interesting thing about it is when you ask a question, other people usually come up and say, yeah, I was wondering the same thing myself. So, have a good day. We'll talk again soon. Take care. This lady said she recognized me from the Vegetarian Club, but I'd never met her before.